From the outside, most Indiana nursing homes look comfortable and safe. But inside these facilities, it's often a different story. Every single day, thousands of elderly Hoosiers suffer neglect and harm in long-term care facilities across the state. They are the forgotten Hoosiers, frail, dependent citizens who desperately need some assistance. Most of them are incapacitated, powerless to complain about their situation. And many of those who can complain keep silent out of fear of reprisal. They are nursing home residents. Their plight is the shame of Indiana. Nearly everyone familiar with the situation agrees that the major problem in nursing homes today is understaffing. There are simply not enough staff to provide adequate care for thousands of Indiana's most vulnerable and fragile citizens. Indiana has roughly 500 nursing homes housing more than 35,000 residents, most of whom are poor, have no family to visit them, and need constant care. But in many cases, nursing homes are not meeting even their most basic care needs. In fact, the federal government says that Indiana's nursing homes are among the worst in the nation in terms of staffing. Robin Grant is a long-term care policy director for United Senior Action. She's one of the state's leading advocates for nursing home reform.
There are many factors that contribute to the quality of care and getting good care in a nursing home. But of all the factors, the number one most important factor is staffing. If you don't have adequate numbers of well-trained, well-supervised, and consistent staff providing care to residents, you can't even begin to provide quality care.
In late 2008, the federal government launched a new nursing home rating system to make choosing a nursing home easier for elderly Americans and their families. The 5-star rating system is similar to that used to rank hotels and motels nationwide. The findings for Indiana are grim. Indiana ranks as the 6th worst state in the nation in the area of nursing home staffing. Indeed, nearly 60% of Hoosier nursing homes had below average staffing standards. That compares to 42% of facilities nationwide. Even more alarming, 39% of the state's nursing homes received the lowest rating, 1 star, in the area of staffing. Put another way, nearly 4 out of 10 Indiana nursing homes rate well below average in terms of nurse staffing.
I think our low scores on the staffing data is an absolute disgrace and needs to serve as a call to action here in Indiana to do something about the staffing problem so that we can improve the quality of care. Because if we don't do anything about it, our scores are going to get even worse, and above all, it's residents who are going to be suffering.
Sadly, nursing home understaffing can lead to neglect, serious injuries, and tragically, even patient death. Experts say that understaffing wrongs the dignity of residents in a variety of ways.
The consequences of understaffing for an individual resident are enormous and devastating, not just physically, but also psychologically and emotionally. The resident doesn't get the help that she needs to go to the bathroom. She's not fed the way she needs to be. She's not given adequate water. So we have malnutrition that results, dehydration that results. When residents aren't turned appropriately, pressure sores may result. Residents suffer falls. We have broken bones. They have an increased number of infections. Hospitalizations, preventable unnecessary hospitalizations result. We have residents that wander out of the nursing home and may end up dying, again, simply because there weren't enough staff in the nursing home.
When there was nobody around, no staff, my father fell probably half a dozen times, some of those times requiring trips to the hospital.
I witnessed my mother sitting in her wheelchair, crying for help, begging for them to come and take her to the restroom. I actually sat in the room on more than one occasion when my mother would hit the arm of the wheelchair and say, "Help me, help me, help me, I have to go to the bathroom. I can't wait any longer." The call light would be on. It was not uncommon for the call light to be on for an hour and a half.
I've seen people just like having to get out of bed, pushing a button, the button's never getting answered. I've seen people sitting in halls waiting to be showered, that they can't be showered. They're lined up because there's no one to do it.
In addition to the harm caused to elderly residents, nursing home understaffing takes a toll on family members too.
So it's tremendously hard to place someone you love into the hands of someone else. But when you do that in a nursing home, the expectation is that these are healthcare professionals. My loved one will get the care they need. And sadly, far too often, family members find that that is not the case. They'll come into the nursing home and find that basic care has not been provided. You know, mom hasn't been bathed. She hasn't been taken to the toilet. They're placed in a position of having to constantly raise concerns with the nursing home. That is hard for many, many people to do. Staff sometimes don't appreciate the fact that a family member is raising these concerns. So that can create sometimes an adversarial and sometimes even a hostile relationship between the family member and the nursing home staff.
I hate to go in and be demanding that they pay special attention to my mother, because no one deserves special attention over another person. But yet, how long are you supposed to wait before you make sure your relative is getting the proper care?
I had to ask, can someone come in and check his vitals? Can someone come in and do this and that? That you're more or less just, in my view, neglected.
It's not only nursing home residents and their families who suffer due to understaffing. Indiana taxpayers pay, and pay dearly.
When residents don't get the care they need because there aren't enough staff, there are increased infections, there are falls that send residents to the hospital. Treating a pressure sore alone can go up to $40,000, if not more. Every single time a resident has to be treated for a condition that should never have occurred in the first place, the resident suffers and we suffer too, because we're all paying more for that care.
Federal investigators at the Centers for Medicare and Medicaid Services have released a report on nursing home abuse and neglect. It finds that in 2007, nearly 90% of Indiana nursing homes were cited for violations of federal health and safety standards. Problems included infected pressure sores, medication mix-ups, dehydration, and neglect of patients. The same federal report revealed that 35% of Indiana nursing homes were cited for actual harm or immediate jeopardy in 2007. That's more than twice the national average of 17%.
For the past 3 years in Indiana, 1/3, and in some cases more than 1/3 of our nursing homes have been cited for causing actual harm to our nursing home residents, or what's called immediate jeopardy, which means that residents have been seriously harmed, injured, killed, or at risk of being seriously injured, harmed, or killed. That's appalling.
And here in Indiana, the situation may be much worse. Federal investigators at the Government Accountability Office released a report in 2008 on the effectiveness of nursing home surveys. It finds that fully 40% of Indiana's nursing homes actually underreported serious deficiencies in patient care. These federal studies make it clear that many of Indiana's nursing homes are systematically failing to provide staff in sufficient numbers to serve their residents.